Welcome to America Today, your go-to source for in-depth, unbiased news coverage on the issues that matter most to Americans. If you haven't already, hit that subscribe button right now and turn on notifications so you never miss an update on breaking stories like this one. Now, let's dive into today's top story. Bipartisan anger is brewing over the drama that unfolded at the Centers for Disease Control and Prevention (CDC), with the top members of the Senate's healthcare panel forming a united front in the midst of the turmoil. This unprecedented shakeup at one of the nation's premier public health agencies has sent shockwaves through Washington, D.C., and beyond, raising serious questions about the future of vaccine policies, public trust in health institutions, and the politicization of science under the current administration. To fully understand the gravity of this situation, we need to step back and examine the sequence of events that led to this boiling point. It all began earlier this year when President Donald Trump, in his second term, appointed Robert F. Kennedy Jr., a longtime vaccine skeptic and environmental activist, as Secretary of Health and Human Services (HHS). Kennedy's nomination was controversial from the start, given his history of promoting theories that question the safety and efficacy of vaccines, including mRNA technologies used in COVID-19 shots. Despite pushback during his confirmation hearings, Kennedy was sworn in, pledging to make America healthy again, by rooting out what he called corruption in federal health agencies. Fast forward to June 2025, when Kennedy made his first major move. He abruptly dismissed all members of the CDC's Advisory Committee on Immunization Practices (ACIP), the panel responsible for recommending vaccines for public use. This committee, composed of independent experts, had been a cornerstone of U.S. vaccine policy for decades. Kennedy justified the purge by accusing the members of being influenced by pharmaceutical companies and failing to address what he described as vaccine injuries and misleading data from the COVID-19 era. The move was met with immediate outcry from medical professionals, who warned that it could delay critical vaccine approvals and erode public confidence in immunization programs. But the drama escalated dramatically last week, on August 28, 2025, when President Trump, at Kennedy's recommendation, fired CDC Director Dr. Susan Manaras. Manaras, a career public health official with over 2 decades at the agency, was ousted amid allegations that she was untrustworthy and had participated in what Kennedy called a culture of deception during the pandemic. In a fiery statement, Kennedy accused Manaras and other CDC leaders of lying to the public about vaccine side effects and suppressing data on alternative treatments. This was absolutely necessary, Kennedy later told lawmakers, emphasizing that the CDC needed a complete overhaul to restore integrity. The firing didn't stop there. In the days following Manaras's dismissal, several senior CDC staff members resigned in protest, including key figures in epidemiology and vaccine research. 18 sources within the agency described an atmosphere of chaos, with morale at an all-time low and fears that ongoing public health initiatives, such as tracking emerging variants of COVID-19 or preparing for flu season, could be compromised. One anonymous CDC employee told reporters, "We're losing institutional knowledge overnight. This isn't reform. It's demolition." This series of events culminated in a high-stakes Senate hearing on September 4, 2025, before the Senate Finance Committee, which oversees HHS and has jurisdiction over healthcare funding. The committee, chaired by Democrat Ron Wyden of Oregon, and with Republican Mike Crapo of Idaho as ranking member, called Kennedy to testify on the administration's healthcare agenda for 2026. What was intended as a routine budget discussion quickly devolved into a grilling session over the CDC turmoil. From the outset, the hearing was marked by bipartisan frustration. Senator Bill Cassidy, a Republican from Louisiana and a physician by training, who serves on the Senate Health, Education, Labor, and Pensions Help Committee but was invited to participate, led the charge. Cassidy demanded that the ACIP meeting scheduled for next month be postponed until a full investigation could be conducted. "We cannot allow vaccine guidance to be issued under these circumstances," he stated emphatically. "It's illegitimate until we get to the bottom of this." His concerns echoed those of independent Senator Bernie Sanders of Vermont, who, despite his progressive leanings, joined forces with conservatives in calling for a bipartisan probe into the firings. Sanders, known for his advocacy on healthcare access, expressed alarm over the potential impact on vulnerable populations. This isn't about politics, it's about protecting the American people from hasty decisions that could endanger lives, he said. Democrats were equally vocal. Chairman Wyden pressed Kennedy on the specifics of Menard's firing, questioning whether it violated civil service protections and demanding transparency on communications between HHS and the White House. 11 inches. You can't just fire experts because they disagree with your worldview, Wyden argued. Kennedy, unrepentant, defended his actions by recounting his version of events. He claimed Menard had admitted to being part of a system that misled the public during COVID-19, and he accused her of blocking reforms. When pressed on evidence, Kennedy pointed to what he called whistleblower reports and declassified documents from the pandemic era, though critics noted these claims lacked independent verification. The hearing turned particularly rancorous when discussions shifted to vaccine policies. Kennedy has been outspoken about his skepticism toward mRNA vaccines, suggesting they cause more harm than good, a position that contradicts the consensus of the global scientific community. Senators from both sides expressed worry that the CDC shakeup could lead to delays in approving updated COVID-19 boosters or other vaccines, such as those for hepatitis B. 12 Republican Senator Rand Paul of Kentucky, a libertarian-leaning voice, offered some support for Kennedy's anti-establishment stance, but even he cautioned against overreach. "We need accountability, but not at the expense of public health readiness," Paul noted. Beyond the Senate chamber, the fallout has rippled across the medical and scientific communities. The American Medical Association (AMA) issued a statement condemning the firings as a dangerous precedent that could deter qualified experts from public service. In their September 5, 2025, advocacy update, the AMA highlighted bipartisan concerns and called for congressional oversight to prevent further erosion of agency independence. Public health experts, including former CDC directors like Dr. Tom Frieden, have warned that the instability could hamper responses to future outbreaks. "The CDC is our first line of defense against pandemics," Frieden said in an op-ed. "Politicizing it risks everything we've built. To appreciate why this drama has united unlikely allies, it's essential to delve into the historical context of the CDC and its role in American life." Founded in 1946 as the Communicable Disease Center, the agency evolved into a global leader in disease prevention, with a budget exceeding $10 billion annually. During the COVID-19 pandemic, the CDC faced intense scrutiny, accused by some of downplaying risks early on and by others of overreaching with mandates. President Trump, who has repeatedly claimed he was lied to by health officials during his first term, has made reforming these agencies a cornerstone of his agenda. His alliance with Kennedy, once a Democratic presidential candidate who endorsed Trump, underscores this push for disruption. Kennedy's background adds another layer to the controversy. As the son of former Attorney General Robert F. Kennedy and nephew of President John F. Kennedy, he carries a famous name but has spent much of his career outside mainstream politics. Through his organization, Children's Health Defense, he has challenged vaccine safety for years, filing lawsuits against pharmaceutical giants and promoting books like The Real Anthony Fauci, which criticizes federal health leaders. Supporters view him as a crusader against Big Pharma. Detractors label him a conspiracy theorist whose views have contributed to vaccine hesitancy, potentially leading to outbreaks of preventable diseases like measles. In the hearing, Kennedy doubled down on these views, accusing dismissed experts of lies and defending cuts to mRNA research funding. He argued that the changes would redirect resources toward chronic disease prevention, nutrition, and environmental health, areas he claims have been neglected. However, Democrats like Senator Elizabeth Warren of Massachusetts, who joined the questioning remotely, highlighted the human cost, potential losses in Medicaid funding and disruptions to programs serving low-income families. Public reaction has been mixed, reflecting America's deep divisions on health policy. Polls conducted in the wake of the firings show that while Trump's base largely supports the shakeup, viewing it as draining the deep state swamp, independents and moderates are concerned about instability. Two social media platforms, including X, formerly Twitter, have exploded with debates. One viral post from a healthcare advocate read, "Bipartisan fury at CDC, this isn't left versus right, it's science versus chaos." 20 conservative commentators praise Kennedy for boldness, while liberal outlets decry it as an assault on expertise. Looking ahead, the implications are profound. The Senate Help Committee, co-chaired by Cassidy and Sanders in a rare bipartisan partnership, is drafting legislation for an independent investigation into the CDC's leadership changes. 6. This could include subpoenas for internal documents and testimony from ousted officials. Meanwhile, the ACIP's upcoming meeting on COVID and hepatitis B vaccines hangs in the balance, potentially affecting school mandates and travel requirements. Experts warn that prolonged turmoil could exacerbate existing challenges, such as declining vaccination rates and preparedness for new threats like avian flu. Dr. Ashish Jha, former White House COVID-19 coordinator, told CBS News, "We're playing with fire. Public health isn't partisan. Diseases don't care about politics." 10. On the international front, allies like the World Health Organization have expressed concern, fearing U.S. leadership vacuums could weaken global health security. Domestically, states are stepping up. California and New York have announced plans to bolster their own health departments in case federal guidance falters. As this story unfolds, one thing is clear: the CDC drama has transcended party lines, forcing lawmakers to confront the delicate balance between reform and recklessness. In a polarized era, this bipartisan unity, however fragile, offers a glimmer of hope that common sense can prevail. That's the latest from America Today. For more on this developing story and other national news, subscribe now and join our community of informed viewers. What do you think about the CDC shakeup? Drop your thoughts in the comments below. Stay tuned, America, we'll be back with more updates.